you. Thank you all so much. Let's go ahead and get started. Good evening and welcome. Thank you so much for joining us. I'm Shelly Hornback, the Director of Community Relations for Litchfield Elementary School District. We're delighted to have you here tonight and appreciate you spending some time with us. We have 17 schools, including our brand new Litchfield Elementary, our brand new Digital Learning Academy. It's very exciting for us. Feel free to jump online and check out our new DLA. We're in 4 Arizona cities. That's Avondale, Buckeye, Goodyear, and Litchfield Park. We've got A+ schools, award-winning teachers, and a highly engaged community, very strong PTA, PTO, and community partners who help us achieve educational excellence, and they've been doing that with us for 104 years. So we're really excited about all of that and appreciate you celebrating with us. It's my honor to serve as our moderator this evening, and our webinar is called Educational Excellence in a Pandemic. We're going to spend the next hour chatting with Superintendent Gunning and Dr. Anna Moran, the Medical Director at HealthyVerify Certification, to examine some of the current research about COVID and vaccinations, health and safety protocols, and we'll drill down to see what does that mean for students and staff in the Litchfield Elementary School District. So thank you to those of you who are joining us on Zoom, and also to the folks who are going to watch this on the Litchfield YouTube channel at a later time. We're really grateful that we can record this and make it convenient for people to tune in when they're ready to hear some of this outstanding content. Before we meet our guests, let's just touch on some housekeeping items. Other than myself and our featured speakers, we'll keep everyone muted for the hour, but you can go ahead and comment, please, in the chat box as you would like to ask questions or follow up on anything that concerns you. You can see each other, right, on the Zoom call, so that creates a sense of intimacy, and we really appreciate all of you who are tuning in and showing us your smiling faces. Thank you for that. More thanks to the many people who sent in questions in advance. That really helps us shape the conversation for what you are looking for. We're going to prioritize those questions, and then if we have any extra time, we'll try and hit some things that are in the chat box as well. Of course, we encourage courtesy in the chat box, and I'd like to offer special thanks to our community relations intern. Talia Uretsky is with us. Hi, Talia. Thank you for being here. She's a senior at NAU, and she's helping us moderate the chat messages. And she's going to drop my contact information into that chat box. And we encourage you to follow up with my office if you have any questions or if you need anything after this webinar. So one more thing before we get going, we have a surprise guest, a new extra speaker who's going to share with us some specific information about HealthyVerify certification. Thank you to Kevin Burke, the CEO of HealthyVerify. We appreciate you being here. Could you take a brief moment and let us know what is HealthyVerify certification and what are you doing to support schools right now?
Sure. Well, thank you. Very special guest, maybe a little bit over the top, but thank you. HealthyVerify is the company that Litchfield Elementary contracted to help them with the virus mitigation protocol. So we work with schools, businesses, venues, you name it, to help them navigate all this content that's coming from the CDC, state, and other agencies, interpretation. I've been with HealthyVerify, just joined recently, but we're a client. So I own a rock climbing gym in North Scottsdale called AZ on the Rocks. We've been open for 17 years. We hired HealthyVerify last April because we were getting all this data and I didn't know how it applied to a climbing gym. So I found HealthyVerify. They came out, Dr. Moran came out. She'd never been to a climbing gym, I don't think. She didn't know what to make of it. Helped with our 13 pages of protocols. So when we opened in May, we were ready to go because our staff and our guests, their safety is paramount. No COVID cases through all gyms getting shut down in the summer. We all had to file a attestation document in order to reopen over the summer. And all I did was file our HealthyVerify certification document. We are one of only 17 gyms, the first 17 gyms to open in Arizona because of that document. And I can tell you that the trust that we've built within our community, because we are taking their health and safety so seriously, has driven people to feel more comfortable to come to our climbing gym. So that's when an opportunity presented itself to join HealthyVerify, I was, hell yeah, I'm in. Because I think I know what we're doing. And with the help of our medical director, Dr. Moran, is in the inner circle of what's going on with infectious disease, the vaccine, COVID, and everything else. And I feel fantastic about aligning whatever Dr. Moran and HealthyVerify says we should do at our climbing gym and any other business. Just gives us a level of commitment that is unparalleled.
Thank you. Thank you for sharing that and for setting all of this up with us. We really appreciate your leadership and your partnership. So thanks a lot, Kevin Burke. We value you. Thank you. Okay, so friends, let's move on. We'll chat with our featured speakers. And Superintendent Gunning, we will start with you. So why don't you start, please, and share a little bit about yourself, your history with Litchfield Elementary School District, and also we'd like to hear about what's motivating you right now to push through this really tough time in public education.
Thank you. Thank you, everyone, for joining us tonight. And thank you, Dr. Moran, for being such a tremendous support, resource, and just a valued member of our team as we go through the uncharted times of COVID-19. I've been with the district for 18 years, started as a first grade teacher in our district, and just a West Valley girl. My children went through the district as well. And I've just been honored to be a continued part and a family member of the Litchfield School District. One of the things that is tremendously important is really being able to help support our students during this very difficult time and our families. And we wanted to make sure that we have a safe place for our children each and every day, as well as our staff. And I cannot tell you and compliment our staff enough. There is absolutely no place else I'd rather be in a pandemic than with our LESD family. Our teachers and our staff have just risen beyond expectations and really have knocked it out of the park. And so I feel like it is imperative that we have all the resources, all the information for our staff and students and families so that they know they have a safe place to come to each and every day.
Thank you. Thank you, Superintendent Gunning. Really appreciate that. And yours is a special story, but I wouldn't necessarily say it's a unique story in Litchfield School District because it's very common that we have staff and leaders who have been with us for years and decades and have raised their children within this system. Some of our employees, of course, are our own alumni. So we really are a Litchfield family with folks who grew up here and raised their own families within this family system. So very, very special. And thank you for sharing your story. And Dr. Moran, we're so excited. You are just a hero to us. We have so much admiration for your work. We are just floored by your expertise and so grateful for everything that you share with us. Thank you very much for being with us tonight. We can't even imagine how demanding your schedule is. And yet you are prioritizing our community tonight, and we thank you. Welcome tonight.
Thank you. Thank you very much. It is a pleasure to work with my heroes who are educators. As a mother, I think, yes, healthcare workers are very important, but I think educators are just as important in this society. So thank you very much for all you do.
Thank you. Thank you very much. So let's chat for a second about your medical background. And I'm going to take a deep breath because it's a mouthful. We understand that you completed your residency at Henry Ford Hospital in Detroit, Michigan, completed a fellowship at Baylor College of Medicine. You're an infectious disease doc, of course, board certified. You're a clinical associate professor at Barrow Neurological Institute and Creighton University School of Medicine. And of course, with those remarkable credentials, you join us tonight as the medical director of HealthyVerify certification. So did I miss anything there?
No.
Oh, good, because I'm out of breath. So clearly there's no shortage of opportunity to put your expertise to work right now at COVID, in the midst of COVID. Could you give us an idea of how you're spending your professional time right now?
80% of my time is clinical work, and 20% of my time is advising different businesses through HealthyVerify. I would say it's actually 10%. It's through HealthyVerify and working with schools. I also I am a clinical provider for infectious diseases for 2 Indian reservations, Gila River and San Carlos Apache. And I do perform administrative work as the infection control and antibiotic stewardship program director on those 2 Indian reservations. And then I run out of time.
And then you might get in a little sleep and hopefully a little
every
water.
so often.
Wow, clearly Arizona needs you right now. We need you for sure. You are in some hotbed areas, and we just can't thank you enough for your service. Thank you for joining us. We have tons of excellent questions from our community. So with your permission, Dr. Moran, I think we're going to just dive right into some of the nitty-gritty.
Perfect.
Okay, thank you. So some of our registrants took an opportunity to prioritize some very common questions, and let's lead with a few of those, starting with our number one burning question: is the vaccine safe for persons with whatever specific health issue that person might have?
Yes, definitely, yes. Right now we have 2 vaccines that have been authorized under emergency use for administration to mostly adults, except Pfizer can be given to children 16 or older, and Moderna can be given to people 18 or older. And Friday, FDA will meet to evaluate a 3rd vaccine that everyone expects that will be approved under similar conditions. But yes, the vaccines are safe. And I'll do one paragraph of why they are safe. Essentially, they were tested, all 3 vaccines have been tested under the same rigorous scientific evaluation that is normally done for other vaccines that we already give ourselves and our children, including flu vaccine, the meningococcal vaccine, MMR, HPV, all those vaccines that already are in the market. The mRNA vaccines and the Johnson & Johnson vaccine have been tested in identical way. The process has been as fast as it has been because of a coincidence of wonderful, wonderful factors, including worldwide scientific collaboration, incredible federal financial commitment, and cooperation from the community, of course, because you need volunteers for those clinical trials. And there was a plethora of volunteers working on getting those studies ready in almost record time. And the only difference is the post-approval time, which normally would be a couple years in other vaccines. In this case, it's already undergoing, and obviously the reason is because we are under a health threat, an emergency, and we don't have the luxury of waiting 2 years before actually putting it into the public. Already this week, we crossed the gruesome milestone of 500,000 deaths. So that makes it an emergency to actually put it in practice. And so far, About 62 million doses have been administered. I got the numbers here actually. 64 million doses have been administered as of yesterday, and that is 44 million people have been vaccinated. And the number of serious reactions have been 4.5 per million vaccines, 4.5 per million. So all those things that I just said lead me to say, yes, the vaccines are definitely safe.
Wow, thank you. You're coming out of the gate strong with all of this really important information that I don't think is often readily available to the general public.
Yeah, you really have to fish for it. And there's very nice resources that I can share with you after the meeting, and you can email to your community. They are a Google away. You can find it. You just have to fish it. And I will use the opportunity. Do not get your information from social media. There's plenty of readily available sources like this. I actually Googled this, and I ended up in the Johns Hopkins website, and I got that information from there. It's also in the CDC, which is also, you don't need a password to read at the CDC, and it's at all levels of understanding. It's not just for providers, it's for general public.
Thank you. Thank you. It comes with a great sense of reassurance when it's offered to us from an expert like you. So we really appreciate you being the vehicle for our learning. Thank you for that. And you touched on this, but do you want to build any more about how do we know the vaccine is safe because it was developed so fast? So
go ahead.
Go ahead. There's our question.
So exactly what I said. Normally, so I'll tell you how vaccines are they are created and evaluated, and it takes up, it may take decades to put a vaccine in the market. So there are factors like the science, right? Obviously, in 2020. We are much better off than in 1990 in terms of what we know and the discoveries. And the messenger RNA technologies, by the way, it's a new platform for vaccine, but it's not a new technology. They were developed initially in the 1990s as a treatment. They were developed about 15 to 20 years ago. So there's human use in the market already, FDA approved for mRNA technology. But this is the first time that they are used for the purposes of a vaccine, but it's not the first time at all that they're used in humans. In fact, there is 2 to 3 decades of experience with this technology. So that's science is a part, money is the other part. Remember, the pharmaceutical companies can't work at a loss, right? And it takes money. It costs hundreds of millions to perform or execute phase 3 studies, hundreds of millions. Not only that, but also requires time if diseases are rare. Obviously, if you need to accumulate 30,000 individuals and look for a very rare disease, it's going to take a while to get that. It turns out COVID has not been rare in the last year, particularly during the late spring and summer, when most of these phase 3 studies were performed here in the United States. So they actually got to enroll a total of 70,000 volunteers between the Moderna and the Pfizer trials, 70,000. The average enrollment for any of the vaccines we already know is 20 to 30,000. So they actually had the same number of volunteers as previous trials for other vaccines. And then, of course, I was talking about the financial aspect of it. So the federal government last year put in $25 billion into finding one or more candidates for vaccines. So that removed the financial risk from the pharmaceutical companies, and they just, all hands on deck, they got it done. Not only that, but typically, the phase 1, 2, and 3 are done one after the other. In this case, they were done, there was overlap. So parts of those 3 phases were done at the same time. So that saved time in the total and made it possible to actually roll out the vaccine to phase 1A individuals in mid to late December last year. So that's about 10 months after the conception of the vaccine.
Wow, interesting backstory there. Thank you so much for filling in some of the blanks for us, and for touching on the seriousness. Obviously, we've had friends and family in our Litchfield family who have been affected clearly by this, including some deaths, unfortunately, and people who've been very sick. It's been a really tough time, as everyone knows. It's not a new story. Yet the vaccinations are a ray of hope and excitement for us. And in fact, we brought our kindergartners through second grade back to school this week.
Wonderful.
Yep, we're absolutely thrilled. And the vaccinations were only one part of that conversation. There were several factors to consider. But Superintendent Gunning, can you weigh in for us a little bit about that? We've got kids back in school. How's it going?
Absolutely. Well, it's definitely a ray of sunshine and tremendous hope that the end might be somewhat near. So things are going really well. All of the safety protocols were revisited and are in place, and the students are doing an amazing job. They definitely have risen to the occasion. Even our littles that are in preschool, wearing masks has become second nature. So it's going really well. See lots of smiling faces and definitely lots and lots of happy teachers as they were able to greet their children. And I know the other teachers in the upper grades, 3rd through 8th grade, are super excited for next week for their children to return as well.
Thank you for that. And we know our teachers are very excited, and staff are very excited about the vaccinations, and a lot of that enthusiasm is on the school campus now. Does that mean we get to loosen some of our protocols now that we have so many adults on campus who are vaccinated?
No, we're keeping everything in place exactly as it was. So physically distancing, wearing of masks, and cohorting our groups, all while making sure that we are disinfecting and doing lots and lots of hand washing and using hand sanitizer as well. So all of the protocols have remained exactly the same.
Okay, thank you. And can you help us understand, so we're really clear on what is a cohort? What does that mean when we're cohorting?
Cohort means that we don't have children intermixing, so that they're with maybe some kids in the morning in a different group during different classes or later in the afternoon. So that group actually travels together all the time, even when they're on the playground, so that they're always together with the same people, and they're sitting with the same people, the same group of students when they're in the cafeteria, and maintaining and staying with that same group even in their classrooms.
I see. Thank you for that. Okay. Yes. So the vaccination is really exciting for us. Our teachers and staff have embraced it. We're grateful to them. We're grateful to Arizona, of course, for prioritizing us. And Dr. Moran, can you help us learn a little bit more about what that looks like? Is that going to protect us against the newer mutations of the virus?
So Pfizer and Moderna have been tested against the B.1.1.7 variant, better known as the UK variant, and there is no variation. So essentially, it protects the 100%. It's the same efficacy as a wild type variant that we have right now as the predominant one in the United States. It has also been tested against a South African and Brazilian strains, and both mRNA vaccines have slightly lower neutralization. So the antibodies neutralize the virus a little less, 2 to 6-fold less. But in order to render the vaccine completely useless, you need at least 50 to 100-fold times. So the effect clinically seems to be nil. Furthermore, vaccines like Johnson & Johnson and AstraZeneca have been tested in South Africa. And while the efficacy for mild disease has been slightly less compared to, for the South African compared to the other variants, the efficacy for severe disease, in other words, the protection against ending in the hospital or dying, is still 100%. Virtually 100%. So the outcomes that really matter are not affected by the current variants. I will add, though, that CDC has predicted that by March, end of March, the UK variant will probably be really predominant in the United States. All three variants are already in the United States. Well, that's the bad news. Here are the good news, two good news. One is we know how to prevent them from spreading farther, right? Masks, distance, avoid gatherings, wash your hands, stay home if you're sick. And the second good news is the vaccines work. So until you, as a member, well, the teachers are already up for vaccination. They can get the vaccine if they so desire. But other members of the community, until it's their turn, the best way to prevent any bad outcomes is to continue with the mitigation measures, as I mentioned, masks, distance, avoid gatherings.
Thank you for bringing up gatherings. That was one of the questions. Someone was asking, is it safe for about 20 to 30 vaccinated people to congregate inside with no masks if they're all vaccinated? Is that a safe thing to do?
So there are no CDC guidelines yet about that. CDC, as you probably know, they already changed the guidelines for quarantining of those who are vaccinated. It's a tricky question, but I must say, if everyone is vaccinated, it is safer to be indoors. I would still recommend that everyone wears masks and keep distance as possible. Here's the reason why. Not because I think any one of those vaccinated will get sick, but remember, we don't know yet if being vaccinated protects you against catching the virus and giving it to someone else. So if you catch the virus, you don't have any symptoms, and then you go home to a sick spouse or an elderly parent who can't get the vaccine, or an immunosuppressed child, you can bring it home. So until there's more data, we should still be really cautious. And that's probably in part the reason, everyone in the world is gathering this data, because this is the million-dollar question. This is, knowing if it prevents transmission, or at least if it lowers transmission, actually will be part of going back to normal, right? And so the data is not final yet. So until then, I would say it is safe for those in the room, but not necessarily those who live with the people in the room. So be really careful. And again, there are no answers for this question in CDC yet.
Mm-hmm. Thank you.
That was a long-winded answer.
Well, that's why we wanted you to come tonight, right? To really take a deep dive with this stuff. So please share all that you would like. And clearly you're so passionate about this. It's really very exciting just to sit and listen. So thank you so much. It's, dare I say, entertaining, even though it's such a serious topic and we really need to learn, but we appreciate you making it easy for us to understand, and you're very engaging with it. So thank you for all of that.
Thank you.
Thank you. So just sticking with these questions along the lines of the vaccine. So can you help us make sure we know how long after each dose until it actually kicks in and is effective?
Yeah, so you can get protection even after one dose. It's incomplete protection, but protection nevertheless. So the protection starts after day 9 after the first dose. People who get infected after the first dose do so either just before the injection or within those first 9 days. After 9 days, the protection continues going up, and it's as high as 67, 70% just prior to the second dose. And once you get your second dose, after the second dose for Pfizer, the outcomes were measured at day 7 after the second dose for Pfizer and after day 14 for Moderna. So just to make it simple, 2 weeks after your second dose, you are fully protected. You get the full effect of the vaccine, which is about 95% for both Moderna and Pfizer.
Okay, thank you. Good, important facts for us to keep in our back pocket. Thank you for that. I want to toss over to Superintendent Gunning for a moment, because schools were mandated to develop mitigation plans long before the vaccines were available. This was months ago. And of course, ours is available on our website in the COVID section of our website. But Superintendent Gunning, we thought that was pretty good, right? We felt confident about our mitigation plan. We looked with CDC, with ADHS, with the county health department, other school districts. I mean, we had a lot of folks weighing in on what we thought was a strong mitigation plan to start. Yet we went a step further to partner with HealthyVerify certification. Superintendent Gunning, can you help us understand what added benefit that brought to our staff and students?
Absolutely. So it was important to us that we knew that we weren't necessarily the experts in this arena. So we wanted to bring in the experts to review our plan to ensure that we had all of the safety protocols that were necessary and needed to ensure the safety of our staff and students. And that was very important. So HealthyVerify was able to take our reopening document and our safety protocols and go through them line by line, and then offer any recommendations or suggestions that they had for improvements. Then in addition to that, once we had gone through that process, then we had a site visit where they really made sure that those safety protocols were in place in our campuses, so that they could visually see all of the different strategies and components that were put into place to ensure, like for physical distancing, ample access to PPE, all of the hand sanitizer stations, and those mitigating measures. So that was a piece. The other piece that they were able to offer is they were able to keep us up to date on the ever-changing landscape of COVID. So we receive weekly emails and updates. Also, I usually receive the CDC updates even before they're posted on CDC to let us know if there's something that we need to change or we have the opportunity to change. Just like right now, we're going through the process of relooking at the quarantine status of someone who's vaccinated. So that was super helpful. And then in addition to that, we were able to have the opportunity to meet with Dr. Moran on a weekly basis to ask any question that we might have, as well as we can send questions at any time if we need additional guidance or we're just not sure about something. And so that was an amazing resource so that we could ensure that we had the best plan possible to ensure the safety of our children and our staff.
Thank you. Really, really helpful. And I mean, boy, just the value we're getting out of this 1 hour. And then you take that with our staff and leadership who have access to that every single week and more often if necessary. That alone is a game changer to me, and a million other benefits as well. So thank you for explaining that. You touched on PPE, which of course is very important in the mitigation plan. What does that look like for Litchfield School District? Do we have enough? How does that work?
We actually created what we call a COVID warehouse, where we have resources readily available within our district. Schools are able to create little stations to have PPE on hand to backfill if there's anything that they need. We wanted to make sure that we had masks available for anyone who needed them, ample hand sanitizer, disinfectant, and just anything that they may need, plexiglass if needed, especially put up some plexiglass pieces for our littles, just to ensure that we had as many mitigating factors as possible. And we wanted to make sure it's readily available and easily accessible for our staff at any time.
Thank you. I would say now is also a great time to give a shout out to one of our community partners. We were very fortunate to recently have our Litchfield School District Foundation write for a COVID relief grant to the city of Litchfield Park. And we're grateful to Mayor Schoaf and the council for approving a $10,000 grant to the foundation. They're going to use that to buy masks and hand sanitizer to amp up our PPE supply even more. So lots of support from our community is just gravy and helping us be successful in COVID. Thank you very much for that. Let's switch back here to Dr. Moran for a moment, if we may. I think we've got some other questions from our community specific to you. And, oh yeah, that's right. Okay, someone is really curious about this one. How safe is COVID-19 with people who have a low immune system? So I think they mean the vaccine. How are
the vaccine?
Folks with, yeah, how safe is that vaccine if you've got a compromised immune system?
There actually in the Pfizer and Moderna trials, there was a small subset of patients who had chronic illnesses, including autoimmune diseases, and they were pretty safe. So the short answer to that question is pretty safe. And actually, I would say it's a great idea to include those people in the vaccine because of the chances of getting serious illness with COVID for those people are really high. So it's worth vaccinating.
Okay, thank you for reassuring some folks about that. And then also, can you tell us, and you touched on this again, but I think it's such a popular question. I want to make sure we have the deep dive. How does the vaccine work if it doesn't actually prevent you from getting COVID?
Yeah, so the vaccine has little pieces of the genetic material of the virus. And that genetic material or messenger RNA encodes or helps manufacture the spike protein. If you think about the little cartoons of the virus, you see those little spikes, the red spikes around the virus, that's the spike protein. And it's very important for two reasons. Number one is the key to the human cells. So the spike protein latches onto receptors receptors on our cells, and that's how it infects us. The second reason why it's so important and the target of all the vaccines developed so far is because the immune system in us humans, the immune system responds to the spike protein mostly. So, and not only that, but prevents infection when antibodies against the spike protein appear. So two great reasons to target the spike protein. So as I was saying, the messenger RNA is a little piece of the genetic material of the virus. It does not synthesize the whole virus. It just synthesizes the tiny little spike protein. And it uses our own cells to create that protein. And our cells, once the protein is created within our cells, it gets shown into the immune cells, into the soldiers that create antibodies and memory, and immune memory that will protect us immediately and for years to come, hopefully for years to come, I should say. That messenger RNA remains in our body for just a few weeks, no more than 2 months, and then it disappears and it's taken care of by our own cells. Our cells are used to messenger RNA. Actually, our cells produce our own messenger RNA. That's how we synthesize our own proteins, etc. So that's how they work. And like I said, they do not enter the nucleus, so they will not alter your genetic composition. Remember, the nucleus has DNA, not RNA, so completely different materials. So it doesn't get into the nucleus, so you are not going to have your genetic composition altered, number one. Number two, does not synthesize the whole virus, so you will not get infected with this vaccine. And thirdly, it gets degraded quickly once it's done what it's supposed to. It gets sort of digested and degraded by our own cells.
Now, do you think that we'll get to a point where we'll have to have more vaccines in the future, years down the road, maybe?
We don't know. What we know with good certainty is that the antibodies last, the neutralizing antibodies last at least 3 months, in some studies up to 6 months. And then the second part of the immune response. So one part is the antibodies, the other part is the cells, the cell immune response. So the cellular immune response tends to be what will protect us in the long run. And the long run depends on the infection, could be years or could be lifelong. And we don't know really for this vaccine. We barely have some data for 6 months, because remember the clinical trials were done during the summer and early fall. And then we're just rolling out the vaccine to the general population, so it's hard to tell. The hope is that this is not going to be an annual vaccine. That's the hope, based on what we know about the immune response to coronavirus, but it's really not known. Then I think another aspect that is important in terms of are we going to need a booster is related to the variants, right? As we said, the variants, not the UK, but the other two have a little lesser neutralization effect. The vaccines have lesser neutralization effect. They're not rendered completely useless yet, but if it happens, the companies are already working on creating a vaccine that will have pieces of RNA for different types of variants. It's called a multivalent vaccine. So it is possible that in the future, and future meaning, maybe 6 months, a year, there might be the need for a boost for the variants, but it is not clear yet. So I don't want to make any predictions because I know I'll be wrong. So, but that's what's in the pipeline or in the conversations or discussions among the experts.
Mm-hmm. Well, we know here that the great value that you bring to us is helping to, one of the great values is navigate that ever-changing landscape. You don't want to make a prediction because it's going to change. And that is what, what's happening daily and sometimes hourly at some points. And so we can fully appreciate that it's really hard to predict. That's why this is our hashtag year of flexibility. Yeah. Superintendent Gunning coined that fun term for us, and it's true. We're really living up to that at every level and every sense.
And I just want to use your opportunity also to convey this message to the community. So it's been a year of difficult messaging from the scientific community to the general public, because science, the facts change so rapidly. So as doctors and scientists, we've learned during this year to be humble, stay humble about the information and say, this is what we think now. We're doing this to figure it out, but we really don't know. So it's been a year of, like you said, being super flexible and being open to change and adaptation. That's very important when you listen to the experts say one thing and then 2 months later or not even 2 months, but 2 weeks later is something different. Is because the discoveries, the facts, the results change constantly. So I want people to understand we are trying to be super humble and super open to being wrong or not knowing the answer.
Thank you. We really appreciate that. And Mr. Goodwin, I see your comment in the chat here. It's ironic you posted because we're circling back now to Superintendent Gunning, and we do have your questions in our notes. So thank you very much for that. We may as well jump there now. It's coming right up on our agenda. Superintendent Gunning, can you chat with us about contact tracing and its effectiveness?
Yes, absolutely. So one of the things that we added into our protocols was that there are seating charts. So we track everything. So everything's very systematic. So it's not going to be probably as much fun as typical of having a lot of movement in a classroom. It's, they have their assigned seat and then you know exactly who's sitting around every child. Same thing with on our school buses as well. So anyone who rides a bus. Who conducts the contact tracing, the principal, and works alongside of the school nurse. And then from an employee perspective, also alongside of our HR department to walk through that process. And it's very systematic and it's been very effective. So many of you may know we had on-site learning, free on-site learning for any child who needed a place to go since August. So we've had children on site, as well as we had classes with our neediest of children going on throughout the year as well. So all of our schools and campuses have had a lot of experience with the contact tracing and being able to have those systems in place so that they feel really comfortable when a case or an issue does come up.
Thank you. Thank you for sharing that. Dr. Moran, do you have anything to supplement that response?
No, not really. I think it's
Yeah.
a great idea. Yeah.
Okay, thank you. Yeah, that's pretty specific to our district and common with other districts as well, I would say. Not identical. The mitigation plans can vary from district to district, and we only speak on behalf of Litchfield School District, but we do find a lot of commonalities throughout the mitigation plans with a variety of districts. Continuing along those lines, Superintendent Gunning, speaking of our mitigation plan, can we also talk about physical distancing? What does that look like in the classroom? And also, do we have barriers in the classrooms?
So in the classroom, of course, we try as much as possible. The goal is to be able to physically distance every student. The minimum physical distance is 3 feet. And 6 feet if possible. But we do also require all students and staff to wear face coverings while they're in the classroom, and also while they're outside or anytime that they can't be physically distanced. Though we do provide opportunities for children to take mask breaks, because we want to make sure that they have the opportunity to take a break from that. And you'll start to see, probably if you're driving around the schools, you'll see a lot of students doing their snack time or those types of breaks outside, because we know that that's the best place and best location for them to be able to do that physically. They can distance easier, and then you also have all of the fresh air.
Thank you for that. And Dr. Moran, from a medical perspective, do you have any commentary on masks? Maybe what type of mask is best or not advisable, and also reusable masks, how often should those be cleaned, and is there a specific way to do that?
Yeah, that's a great question, especially at this time, because as you know, the CDC put out a recent guideline on what are the best masks, and the topic of double masking has been really popular in the last couple weeks. Because of the variants being more transmissible, etc. So here's the advice. And again, one of the things we're also learning is that advice should be tiered. It's not a on and off or yes or no to anything. It's really more nuanced than that. So going back to masks, what the CDC recommends is either wearing double masks with cloth mask and a surgical procedure mask, or a cloth mask with a filter. And then they do give other options as well. But I would say for children, a cloth mask with a filter as best as possible is great. As a general statement, the best masks are ones that are well fitted. So not too loose, not too tight, obviously. It should cover both nose and mouth. It should be at least double layered. Ideally, with a filter, and the fabric should have tight fibers, not loose, like not three layers of cheesecloth. That's not going to work. It has to be tightly woven fabric. The surgical masks are good as well, but they recommend that they have to be well fitted, and there's a nut and tack, and essentially, so this is what we wear in the hospital. So you can knot it, make a knot here, and then tuck in this side inside. So it's really, really well fitted. It's in the CDC, the knot and tuck. That's another option. For little children, I think the age-appropriate masks, so the smaller size masks are better, because remember the key here is feet. It should be well fitted. And then double layer and or filter. So that's the best masks. And I've been heartened by the experience, not just in Litchfield, but in many other places, that little children respond really well to the masks. They wear it with no problem. Yeah, they have been troopers. So that's probably why you're getting such a great result in your school. Mm-hmm.
Thank you. We're seeing that as well. Superintendent and I are fortunate to share this wall behind me with windows that look out into a beautiful grassy area. and we get to watch these little kiddos come out for their lunch breaks, and they're just so cute with their mats and their lunchbox, and they space really well, and this is their chance to remove their mask for a moment. And it's adorable and amazing how well they have learned very quickly with much respect. And I'm just so proud of our teachers who are teaching these strong safety measures from the start so that we can keep our students and staff safe. Do you ever get to see them, Superintendent Gunning, out your little window there?
Yes, absolutely. It's been a joy to see even more and hear the giggles and the laughter.
Yep, hear their laughter. I gave them permission to knock on my window when I'm in here, and they're taking full advantage. But speaking of kiddos and health and safety procedures, Dr. Moran, and I know you're reluctant to make any predictions, and we definitely appreciate that, but do you have anything you'd like to share about children and vaccinations?
Yeah, so Pfizer just finished enrolling. I can tell you children 12 and older, and their trials are going to be much smaller than the adult trials. And their endpoints are not going to be severe disease, because severe disease is such a rare event among children. So what they're testing actually for children is immune response by doing blood tests and looking at their antibodies and their immune cells and how they respond to the vaccine. And because we know they are a good proxy for immunity, for actual efficacy of the vaccine, we're going to use that as a marker, or a surrogate rather, of good immune response. Moderna, and then in fact, Pfizer finished on January 28th, they finished enrolling their 12 to 15. Because remember, for the big trial, they enrolled 16 and older. And then later on this year, towards the fall, end of the year, they will enroll children 5 to 11. And then Moderna is almost done enrolling 12 to 17-year-old. And then also towards the end of the year, you will see they will start the trials on the 5 to 11 years old.
And are those worldwide or national?
These studies I'm talking about are here in the United States. Yeah.
Interesting. And we're on a thread here with vaccines, so this may be our last vaccine question, but you were indicating previously that some have a higher efficacy rate than others. Some are a little bit stronger, I think. So what if someone wanted to go back and get a higher dose, maybe from a more reputable vaccine? Is that advisable?
You know, let me clarify that all vaccines are excellent. So it's difficult to compare different vaccines, because when they designed the clinical trials, they designed it in different ways. But to make it really, really simple, the outcomes you really want to stay away from or the endpoints you want to stay away from are hospitalization and death, or ICU stay, which has a high mortality. For those, I can tell you the Moderna, Pfizer, Johnson & Johnson, AstraZeneca, the Novavax, Sputnik, which is the Russian vaccine, and the Chinese vaccine, I'm blanking on the name, but they all have virtually 100% efficacy on preventing hospitalization and death. Now, the nuances and the little differences come when you evaluate mild disease. And mild disease in general is runny nose, sore throat, fever, something that you would stay home for, but not something that you will end up having to go to the emergency for. So I hope that is really, really clear. That's a message that I really want to convey, because the danger of not doing so, of not understanding that really they're all equally good for severe disease and death, the danger of not doing that is people might say, well, I want the Pfizer because the Pfizer worked better in this variant than in that variant. And then if there's no Pfizer, but there's Johnson & Johnson, which by the way has plenty of advantages, like one dose, no refrigeration, so plenty of advantages compared to the others. If you get that offered that one, and you say, no, I'm going to wait a month until there is availability for the Pfizer vaccine, and you get sick on that month and you die, I don't think that was a smart strategy. Again, all the vaccines that I've mentioned have virtually 100% efficacy in preventing hospitalization and death. And then again, it depends on the definition of mild or moderate disease, which varies from clinical trial to clinical trial. So for example, if you ask me what vaccine would I give my children, both my children are younger than 16. So they won't be up for vaccination in the fall, until the fall at least. And if in the fall there's Johnson & Johnson, but there's no Pfizer, I will give them the Johnson & Johnson. You bet I will. Even though I know it's only 2/3 effective, or 70% or 75% effective here in the United States. Because it's okay if it's like the flu. Think about like the flu vaccine. In the best year, the flu vaccine is 50% effective, and we all take it. And guess what? It decreases mortality, particularly in people 60 or older, by 40%. So it almost cuts mortality by half, and it's not even as good as the worst COVID vaccine. So again, I want to be clear, all vaccines are really good at preventing the outcomes you want to run away from. And then we'll see. And I just read an article, a white paper from Nature, one of those scientific magazines or journals, that it said, stop comparing vaccines right now, because we don't have enough data of the nuances, right? The mild to moderate. And you're comparing apples to oranges, because every trial had a different design. And one more thing is that mortality and hospitalization benefit on the Johnson & Johnson was also almost 100% in South Africa, where 95% of the circulating virus is that mean South African variant. So it really works. That's my message.
Thank you. Thank you for your passion and for clarifying that, just so there's no confusion there. I hope some of our science teachers share this in their classes. There's so much to learn from you. I just think it's amazing. We're running tight on time, but I want to take a moment to honor Mr. Goodwin's engagement here. We're so grateful for the folks on the line. Thank you very much. It makes for a more interesting experience, and I'm glad that this time was convenient for you. Superintendent Gunning, we would be circling back to you on this one. We're talking about mitigation plans at Litchfield Elementary School District. And how much training do our teachers have on this, and how much updating do they get?
So we meet as a leadership team that includes all principals and all directors every Friday, because we have our webinars with the Maricopa County Department of Health on Thursdays, as well as our time with Dr. Moran later that same day. And so then that way we can share any updates, changes, discuss any situations that have possibly occurred and that we could learn from to do better. And then the principals and directors go out and train their staff and update their staff. So it's an ongoing basis, and we've been doing that. We've been meeting weekly, I want to say since either right before school started or right after, like in August. So we've been doing it on an ongoing basis. We just felt like it was this landscape was ever changing, and things change so frequently that we wanted to make sure that we were always keeping everyone up to date, and not just our school campuses, because we also have departments as well. So we wanted to make sure everyone was safe and that everyone had updated information in a timely fashion so that they could make changes as needed.
Mm-hmm. And that's where our Litchfield family comes in really handy, because we're all such close colleagues, and open door policy, lots of questions going around all the time, training and supporting each other all the time. I mean, it is far more than daily. Tons and tons of support happening for directors and principals, and then they with their teams. So that is something that I get to witness firsthand all the time, and it's very exciting, something I'm proud of here at Litchfield. We are running down on the clock here. Dr. Moran, I'd like to offer the mic to you to see if you have some closing remarks, and then Superintendent Gunning, the same thing.
Well, I just want to start by saying thank you to all educators. I think I said every Thursday when I meet with educators, thank you. What you do is so important for our children. And also share the joy with you of knowing how the science has accumulated. We have accumulated science that stresses the relative safety of in-person education. And I'm very careful with my words. Nothing is zero risk. But to the mitigation measures, now we have added a second layer of protection, which is the vaccines. So to teachers who qualify for vaccine, I would say, I would encourage you to take it. It is an extra layer of protection, and not only to yourself, but potentially, hopefully, if the data proves that it protects against transmission, also for your family and for your students. Again, thank you very much for all you do.
Thank you. Thank you so much, Dr. Moran. We're honored by your support and grateful for your partnership. Thank you very, very much. Superintendent Gunning, I know you've got some things you'd like to share as you close, and if you want to just really quickly touch on that last question here from Christy Bishop, that's a really quick answer. What percentage of our teachers are vaccinated?
Absolutely. So we surveyed our staff several weeks ago. I want to say it was about 2.5 weeks ago. And at that time, we had 70% of our certified teachers that had either already received their first dose or were going to get their first dose. So a large percentage they were very, very eager. We were able to offer 2 educational pods at Abrazo Hospital specifically for all of our staff. And that included all staff members, not just, of course, teachers, but everyone. So that was an amazing opportunity that we were able to offer. We are definitely excited and love seeing the metrics continue to decrease. And we are very, very, very excited to have our children back in our schools and back in our classrooms. And I'm thankful to our staff. I'm thankful to all their hard work and everything that they're doing. And I can't wait to see what they even achieve in this very short period of time, because they've already achieved so much in a very difficult time. And I'm also thankful to all of our families for their support and commitment and flexibility, as well as we continue to learn and grow in the time of a pandemic. And then finally, just very grateful to Dr. Moran for all of your expertise and always being there to answer any of our questions, even though sometimes they seem so silly, but to help us to be the best that we can be in offering the safest place possible for our children and our staff. So thank you all for joining us.
Thank you, everyone. This ends our webinar this evening. We appreciate your engagement. You can watch this recording again on our YouTube channel. And with that, we all bid you good evening. Thank you very much.